Hi, I'm Dr. Bonnie Clipper, the Chief Clinical Officer at Wambi. Today, I'm here with Christina Oldini, Stanford University School of Medicine, Associate Director of Programs, and a leader in perinatal health quality improvement. And it's important for me to say, Christina is a nurse. Christina, thanks so much for taking the time to be with me today.
Well, Bonnie, thank you for the opportunity. Thank you to Wambi. And I have to say, it wasn't easy choosing what themes to remark on, but on some introspection, I'm ready to go.
All right, well, cool. Let me tee you up, Christina. So, our world continues to rapidly change. And as nurses, people often look to us for guidance. So, what thoughts and insights can you share on how we can show up as our best selves every day? And more importantly, what can we do to make the world a better place?
Thank you, Bonnie. Yeah, wow. COVID, racism, Black Lives Matter, and most recently, my mom's entry into hospice care last week. I've chosen these to remark on today. So, public health, recognition and fairness and respect, and then end of life. I'm going to stick with these three. I'm going to start off with public health, population health. Public health professionals tell it like it is. They don't beat around the bush. We need to listen. We need to hear our public health officials at this time. We need to allow them to lead us. Mask wearing, good hand washing, these are the keys to the health of the public. In this year of the nurse, I go back to our intrepid nurse leader, Florence Nightingale, often. There's a great book, Florence Nightingale, The Courageous Life of the Legendary Nurse. It tells us the story of Florence and the other nurses who led really the beginning, really to me, of rapid cycle improvement. She recognized that clean water, clean sheets, light led to the improvement in the status of her patients. Right now, we are seeing multiple thousands of potential rapid cycle improvements across this country due to COVID. Leniency with the guidelines for prescribing medication-assisted treatment for opioid use disorder is just one example. With the data that must follow, we may find that these measures, should they maintain quality and even costs, should no longer be temporary. Recognition and racism. Recognize what's in front of you. Recognition, the acknowledgement of someone's or something's existence, the person next to you. Recognize their existence and recognize that they are equal to you. Recognize that education is a key to the future. It's a key to the future for our children, our world. Do you really know what the definitions, what racism, prejudice, bias, discrimination mean? Do you know what they sound like? Do you know what they look like? Recognize the need to learn, to educate ourselves, and then put it into practice every day. Nurse leader Nightingale got to choose the nurses who went with her to Crimea to care for the soldiers. Her superiors let her know that the nurses who were Catholic would not be included. She recognized, she advocated on behalf of the Catholic soldiers who were in her care. What do you think? Catholic nurses were able to travel to Crimea and attend to the soldiers' suffering. Florence, in the words of author Catherine Reef, wanted the world to move forward. She thought that in nursing, as in every human activity, constant progress is the law of life. In order to progress, to build a brighter future, we must be open through learning and through the recognition that seeing listening, that touching is what is in front of you. Okay, last one. Finally, respect for the end. Recognize what's in front of you. Should you have time to be with loved ones at the end of their lives, treasure it, hold it dear. Families right now, all over the world, in our midst, don't have this opportunity. Seek assistance, seek guidance, seek help. Hospice staff are the salt of the earth. Death doulas are the salt of the earth. When I went through my divorce years ago, I wanted to be able to open a book and look at chapter 3, page 147, and it was going to say, when this happened, do this. That book doesn't exist. It didn't exist then. It doesn't exist now. Know that there are good people out there that can support, that can help. So, public health, racism, respect, recognition. A lot to absorb, Bonnie, but oh, so worth it. My final thought is this. I have my MBA. I am a bottom line thinker. Bottom line, I'm a nurse. I'll always be a nurse, and I will always advocate on behalf of others. Thanks, Bonnie.
Wow, Christina, that speaks to my soul. I mean, we're nurses, right? We're always in there advocating, and what you described, it's really what sums up the contribution that we make, right? We're empathetic, compassionate individuals that advocate on behalf of someone else. And I think with the skill set and the expertise and everything that we bring, those have never been more important skills to take us through whatever it is that challenges us. And the environment now, whether it's the pandemic or the economic fallout from that, or even the racism and diversity and inclusion issues that we are really working through and grappling with, nurses are very, very well skilled and positioned to help in this. So thank you so much for sharing your thoughts with us. And we have a lot to offer and really want to be included in conversations to make the world a better place.
Absolutely. We need to be at the table. My MBA cohort knows what that means. I mentioned it a lot.
I think it's important. And as I've said on some of these, if you look around and there's not a couple of nurses in the room, bring them with you and get them there.
Absolutely.
That's awesome. Thanks again, Christina, for making the time for us today. We all appreciate that. And there's much to learn from the wisdom you're sharing.
Oh, that means a great deal, Bonnie.
And I am Dr. Bonnie Clipper. And remember, at Wambi, moments move us.